Imagine for a moment that your doctor sits you down, looks at your most recent lab results, and tells you with a smile that everything looks perfectly
People who have
fine.
crossed the 60-year
Your total
mark and
cholesterol
realize
is
that no
within the
matter how
normal
much they
range.
try,
Your
to eat
doctor
less
pats you
or
on the
increase
back,
their walks.
and you walk out
The
of the
scale
office
seems
feeling
locked
like
for
you
the
have
steel
dodged a
padlock.
bullet.
Or worse,
You go about
you
your
may
life,
even lose a few pounds,
eating your
but your
usual
face
meals,
looks tired, your
feeling a
energy
familiar
disappears,
mid-afternoon
and that
slump,
little belly
and
remains
dismissing
there,
your fatigue
untouched.
as just
The
another
truth
sign
that
of
the
getting
diet
older.
industry doesn't tell
But what
you
if I
is that
told
the
you that
rules
your
of the game
doctor
have
was looking at
changed.
only half the
What
picture?
worked at 30 or
What if the
40
standard
years old
cholesterol
can
test
become
you're
real
taking
poison for
every
your
year for the
metabolism
past
after.
decade is missing the most dangerous killers lurking in your blood right now? It is a terrifying thought,
Severe
but it is a
calorie
reality for
restriction
millions
is not
of people who
interpreted as
suffer
a
sudden
signal to
cardiac
burn
events
fat,
despite
but as a direct
having a
threat
clean
to
bill
your
of health on
survival.
paper.
When you
Today,
eat too little, your
we are
body
going to pull back the
understands that
curtain
there
on
is a
5
shortage
blood
of
tests that
resources,
actually
and
matter when
instead
it
of
comes to
eliminating
predicting your
fat,
risk of
it
heart attack and
sacrifices your muscle.
stroke. These markers go far beyond the traditional cholesterol numbers that have dominated medical conversations for decades. If you care about your long-term energy, your clarity of mind, and ultimately your longevity, you need to stay with me until the end of this video. Before we dive into the science,
Stop fighting your own
if you
biology.
appreciate this
You're
kind
in
of
the
deep
right
dive
place.
into evidence-based
Go ahead
health,
and like this video.
please take a second to
subscribe,
hit the like
and
button
comment
and
below.
subscribe to the channel. It helps us reach more people who deserve to know the truth about their bodies. Also, let me know in the comments below. Have you ever felt like your lab results didn't match how you actually felt physically? I read every single comment, and your experiences help me shape future content. I am Dr. Harrison Blake, and for the past 15 years, I have dedicated my career to helping people navigate the often confusing world of metabolic health. My objective has always been to strip away the medical jargon and provide you with actionable, science-backed strategies that you can actually use to improve your daily vitality. I have seen thousands of patients who were told they were healthy, only to uncover hidden inflammation and metabolic dysfunction that could have led to serious consequences if left unchecked. My mission is to empower you to take the driver's seat of your own health journey. By understanding these 5 specific blood tests, you are essentially getting a clearer map of your internal landscape, allowing you to make small, consistent changes that lead to massive improvements in your quality of life. Let's start with the first test that often gets overlooked, which is ApoB, or polypoprotein B. You're likely familiar with LDL, the so-called bad cholesterol. For years, we have been taught that high LDL is the main enemy. While that is partially true, the real issue is not just the total amount of LDL, but the number of particles that are actually floating in your bloodstream. Think of your arteries like a highway. LDL particles are the cars traveling on that highway. If you have a massive amount of small, dense particles, they are much more likely to crash and get stuck in your arterial walls, creating the plaque that leads to heart attacks. ApoB is the protein that sits on the surface of these LDL particles. Measuring it gives you a precise count of how many potentially harmful particles are currently circulating in your system. It is a much more accurate predictor of cardiovascular risk than just looking at your LDL cholesterol alone. If your ApoB count is high, it is a red flag that your body is effectively flooding the highway with traffic that could cause a pileup at any moment. Moving to our second test, we need to discuss lipoprotein a, or Lp(a). This is a genetic factor that many people simply do not know about. Lp(a) is a specialized type of LDL particle that is particularly sticky and prone to inflammation. Because it is largely determined by your genetics, you cannot change your Lp(a) level simply by eating more kale or running a few extra miles. Many of my patients are surprised to learn that they have inherited a higher risk profile. Knowing your Lp(a) level is vital because if it is elevated, you have a baseline risk that you must manage more aggressively through other lifestyle levers and, in some cases, medical intervention. It is like knowing you were born with a slightly thinner set of brakes on your car. You do not need to stop driving, but you absolutely need to drive more carefully and keep up with your maintenance much more strictly than the average person. The third test that is critically important is high-sensitivity C-reactive protein, or hsCRP. While the first 2 tests look at the particles that build plaque, hsCRP measures a fire in your body. Inflammation is a driver of chronic disease, including heart disease. When your arterial walls are inflamed, they become like Velcro for cholesterol particles. They get sticky and damaged, making it much easier for plaque to take hold. If your hsCRP is high, it tells us that your immune system is in a state of constant activation. This could be due to stress, poor diet, a lack of sleep, or hidden infections. When I see a patient with high hsCRP, we start looking at their lifestyle immediately. Are you sleeping 7 to 8 hours? Are you managing your stress through movement or meditation? Are you consuming processed foods that trigger systemic inflammation? High hsCRP is your body's way of saying it is under attack from the inside. Our fourth test is fasting insulin. Most people only focus on their fasting glucose, which measures your blood sugar at a single moment in time. However, fasting glucose is a lagging indicator of insulin resistance. By the time your fasting glucose is elevated, you have likely been dealing with insulin resistance for years. Fasting insulin, on the other hand, tells us how hard your pancreas is working to keep your blood sugar stable. Imagine you have a person who is constantly shouting to be heard in a crowded room. If they have to shout at the top of their lungs just to keep the room quiet, that is your pancreas pumping out massive amounts of insulin. Eventually, that person gets exhausted and stops shouting, and the room becomes chaotic. That chaos is the onset of type 2 diabetes and increased cardiovascular risk. Checking your fasting insulin allows us to catch the problem while your pancreas is still working overtime, giving you the chance to reverse course through nutrition and weight management before permanent damage is done. Finally, the fifth test is hemoglobin A1C. This provides a 3-month average of your blood sugar levels. It is the gold standard for understanding your long-term metabolic control. When your blood sugar stays chronically elevated, it acts like a slow-moving sandpaper on the inside of your blood vessels. This process is known as glycation. It damages the delicate lining of your arteries, making them stiff and less able to dilate, which increases your blood pressure and further damages your heart. By looking at your A1C, we can see if your dietary patterns are keeping you in a zone of health, or if they are slowly eroding your vascular integrity month after month. It is not just about avoiding sugar. It is about keeping your metabolism stable so that your system is not constantly oscillating between spikes and crashes. Now, you might be asking yourself how these 5 tests work together. It is important to remember that these are not isolated numbers. They are pieces of a puzzle. Your ApoB tells you the number of particles. Your LPA tells you about your genetic risk. Your hsCRP reveals a level of inflammation. Your fasting insulin shows your metabolic efficiency. And your A1C confirms your long-term blood sugar management. Together, they create a comprehensive picture of your heart health that is vastly superior to the standard cholesterol panel. When I explain this to my patients, they often feel a sense of relief. For the first time, they understand that their fatigue or their anxiety might not be something they just have to live with. It might be a symptom of a metabolic system that is working too hard to stay balanced. I want you to consider your own health routine. When was the last time you actually sat down with your lab results and asked your doctor about these markers? If your doctor is hesitant to order these specific tests, it is perfectly within your rights to advocate for yourself. You can politely explain that you are interested in a more comprehensive view of your cardiovascular risk profile to ensure you're doing everything possible to maintain your longevity. Many modern laboratories offer these as part of standard wellness panel now. And if they do not, you can often request them as add-on tests. This is your life and your body. Being an informed participant in your healthcare is the single best investment you can make. As we move toward the conclusion, I want to emphasize that these tests are not meant to cause anxiety. Quite the opposite. They are tools for liberation. When you know your numbers, you stop guessing. You stop wandering to the health aisle of the supermarket, wondering if this supplement or that diet will actually work. You get to focus your energy on the specific areas that need improvement. If your hsCRP is high, we focus on anti-inflammatory nutrition and stress reduction. If your fasting insulin is high, we focus on intermittent fasting or reducing refined carbohydrate intake. We move away from generic advice and toward a tailored plan that is unique to your biology. Think about the 15 years I have spent in this field. I have seen the difference between those who wait for a crisis to take action and those who take proactive steps to understand their internal data. The latter group does not just live longer, they live better. They have more energy to play with their grandchildren, more mental clarity to focus on their passions, and a deeper sense of peace knowing that they are not just hoping for best, but actively building a foundation of health. You have the power to change your trajectory. It starts with a conversation at your next checkup and a simple blood draw that could change everything. Remember, your body is a brilliant, self-regulating system, but it needs the right information to function at its peak. By looking beyond the basic cholesterol numbers, you are listening to what your body is trying to tell you. It is whispering to you through these markers long before it starts screaming with symptoms. Do not ignore the whispers. Take the time to request these tests, study your results, and make the small, consistent shifts that create lasting change. If you found value in this breakdown, please do not forget to share this video with a friend or family member who might be struggling to make sense of their own health markers. You might be the person who helps them catch something early. And if you have any questions about how to interpret these tests or where to start, leave a comment below. I am here to help you navigate this journey. Subscribe to the channel so you never miss a deep dive into the science of your well-being. Thank you for your time, your curiosity, and your commitment to a healthier version of yourself. Stay proactive, stay informed, and I will see you in the next video. Now, let us peel back another layer of this onion, because I know that for many of you, the journey toward metabolic optimization does not end with the blood test results themselves. There is a secondary, often overlooked hurdle: the psychological weight of change. We often equate health with restriction, with the idea of subtraction. We think about what we have to give up: the late-night cravings, the convenience of processed meals, the sedentary comfort of the couch. But I want to reframe this for you today. Health optimization is not about subtraction. It is about the acquisition of freedom. When your metabolic health is optimized, you are no longer a slave to blood sugar crashes or the afternoon brain fog that forces you to reach for another cup of coffee or a sugary snack. You are reclaiming the autonomy of your own nervous system. Think about the last time you felt truly present, without that underlying fatigue or the distraction of physical discomfort. That state of clarity is your biological birthright, and it is almost always sitting just on the other side of these metabolic shifts. Let us discuss the concept of mitochondrial efficiency. You have trillions of tiny power plants inside your cells called mitochondria. When you are operating on a diet high in processed sugars and inflammatory fats, you are essentially feeding those power plants low-grade fuel that produces a significant amount of metabolic exhaust or free radicals. This creates oxidative stress, which leads to cellular aging and systemic inflammation. By shifting your fuel source toward healthy fats and nutrient-dense whole foods, you are cleaning up the combustion process. You are providing your mitochondria with high-octane fuel that allows them to produce energy cleanly and efficiently. This is why people who make these changes often remark that their skin clears up, their vision feels sharper, and their endurance increases. You are literally upgrading your hardware from the inside out. Many of you have asked me about supplementation. People often come to me clutching a handful of bottles, asking if a specific pill can bypass the need for a fundamental lifestyle shift. The answer is a resounding no. Supplements are meant to augment an already solid foundation, not to patch over cracks of a poor diet and a chaotic lifestyle. Think of your health as a mansion. Your diet, your sleep hygiene, and your movement patterns are the foundation, the structural beams, and the walls. Supplements are the furniture, the curtains, and the decorations. If your foundation is crumbling, buying expensive furniture will not stop the house from collapsing. We address the core, the insulin sensitivity, the lipid panel, the stress response, before we even entertain the conversation about nootropics or targeted vitamins. I want to dive a little deeper into the role of sleep, because I find it is the most underestimated variable in any health transformation. You can eat the perfect diet, track every gram of protein, and hit your lifting goals. But if you are sleeping 5 hours a night, you are fighting a losing battle. During sleep, your brain undergoes a process called glymphatic clearance, a form of neurological waste management. If you cut that process short, you are effectively leaving garbage in your brain. This manifests as cognitive decline, emotional instability, and a massive spike in cortisol the following day. Cortisol is a glucose-mobilizing hormone. When it stays elevated due to sleep deprivation, your blood sugar stays elevated, your insulin stays high, and you are essentially trapping yourself in a fat storage mode regardless of how much kale you eat. If you want to optimize your blood markers, you must prioritize your circadian rhythm. That means morning sunlight exposure. Set your clock in a dark, cool environment at night to let your body enter deep, restorative states. Let us also talk about the social component of health. Many of you tell me that your biggest obstacle is your environment. You have friends who want to go out for drinks every weekend, or family members who take offense if you do not finish everything on your plate. This is a legitimate challenge. However, you must realize that you are the average of the 5 people you spend the most time with. If you are trying to upgrade your biology, you may need to reconsider the environments you frequent. I am not suggesting you alienate your loved ones, but I am suggesting you lead by example rather than by instruction. When people see that you are vibrant, energetic, and happy, they stop questioning why you're ordering water instead of soda. They stop making jokes about your gym habit. They start getting curious. Your transformation becomes an invitation for them to look at their own lives. You become a beacon of possibility. I want to touch upon the concept of longevity versus health span. We all want to live a long time, but living to 90 while bedridden or suffering from cognitive decline is not the goal. The goal is health span, the number of years you spend in excellent physical and mental condition. The data we discuss today concerning insulin and cholesterol provides the blueprint for maximizing your health span. By managing these markers now, you are preventing the accumulation of the micro-injuries that lead to late-life disease. You are building a retirement account for your body. The interest rate on this account is your consistency. I realize that for some of you, the sheer volume of information available online is paralyzing. You read about keto, then carnivore, then veganism, then intermittent fasting, and you end up frozen in indecision. My advice is to stop looking for the perfect protocol and start looking for the perfect feedback loop. The perfect plan is the one that gives you consistent, measurable progress while remaining sustainable for your specific lifestyle. If your blood markers are moving in the right direction, your protocol is working. If they are stagnant, you adjust. It is not a religion. It is an experiment, and you are the lead scientist. As we bring this conversation to a close, I want to leave you with a final thought on the power of patience. Our culture demands instant results, a pill to lose weight, a hack to fix energy, a shortcut to vitality. But the body does not understand shortcuts. It understands cycles, rhythms, and repetition. It took you years to build the habits that created your current set of blood markers, and it will take time to reverse them. Be kind to yourself during this process. There will be days when you veer off the path, and that is perfectly human. The difference between those who succeed and those who give up is not that the winners never failed. It is that they never allowed a single failure to define their trajectory. They got back on track the very next meal, the very next morning, the very next day. You now possess the knowledge to speak to your doctor with confidence, to interpret the data that defines your physical reality, and to take command of your own longevity. You are no longer just a passive participant in your medical care. You are an active architect of your future. I am incredibly proud of you for taking the time to listen, to learn, and to grow. The path ahead is clear. The tools are in your hands, and your potential is entirely undefined. Take these insights, apply them with discipline and grace, and watch how your life begins to shift in ways you never thought possible. Keep looking for those whispers your body sends you. Keep challenging the standard of care that says being average is enough. You were not built to be average. You were built to thrive, to explore, to create, and to experience a life of extraordinary health. Stay vigilant. Trust the process, and continue to serve as the best guardian of your own well-being. I look forward to hearing your progress, your breakthroughs, and your stories of transformation in the months to come. Until then, keep pushing, keep questioning, and above all, keep living with intention. This is the ultimate investment, and I promise you, the dividends are worth every single effort